Oh, sorry. Thank you, Ambassador Colker. We will now move to Chris Elias, who's the president of the Global Development Program at the Gates Foundation, and he's on video conference. Again, if you could take 15 minutes.
Thank you, and everyone else for inviting me to participate in today's discussion. I'll actually take less than 15 minutes because I'm actually calling in from Amman, Jordan, in the WHO office here. And let me thank them for letting me use their video conference equipment. I thought I was meant to make some shorter comments and leave more time for discussion. So I'll just tell you what I had prepared, and then we can follow up with any more detail that you want. Maybe just to build off of Ambassador Colker's statement, though, in looking at the future of global health in the U.S., I think the future is going to be very much like the past, which is that the U.S. has a very, very important leadership role to play in pretty much everything related to global health and development. Whether the budget stays the same or decreases or goes up, I think that, I'm here in Amman for a meeting with the regional polio staff and opportunity to meet with the incoming regional director for EMRO about the Global Polio Eradication Initiative, an incredible partnership that the U.S. has been a core member of since it was launched back in 1988. We, as the Gates Foundation, are a relatively new partner in that polio eradication effort. So I think, I appreciate being part of the discussion. I think the work of the NAM committee is challenging because, having been a reviewer of your report back in 2009, I know you boil a lot of input for an important set of recommendations, and I don't think there could be a more timely moment to really reaffirm the importance of U.S. leadership in the broad global health and development field. If I think about, some of the things from the perspective of the Bill and Melinda Gates Foundation, we're optimists, and so we'll start with some of the positive things. I think that, in large part due to advances in health R&D and in the application of that innovation in programs, in partnerships with a broad range of countries, as well as multilateral, bilateral, private sector, public sector agencies, we're really, as reflected in the SDGs, now within a generation's reach of ending extreme poverty. Living standards in human health have dramatically improved over the last 50 years. And in the past 5 years in particular, we've seen accelerated progress in several important areas. For instance, in child health, in the last quarter century, under 5 mortality rates have dropped by more than 50%. But startlingly now, 98% of the remaining under 5 child mortality occurs in the developing world, with half of those deaths in sub-Saharan Africa alone. So as we've made progress, we've also seen greater inequities around the world in terms of the geographic distribution of the remaining disease burden. We have, to some extent, succeeded in the easier places, the better governed, the less poor places, and as a consequence, the remaining morbidity and mortality is in tougher places, poorer places, less well-governed places, conflict-prone. Many countries, it's hard to tell whether they're pre-conflict, post-conflict, or in the middle of conflict, and that's particularly relevant here in the Middle East region of the World Health Organization, where, frankly, a third of the 22 member states have ongoing significant conflict and humanitarian crises. But again, on the positive side, we've seen our research, and a lot of that, the Gates Foundation funds a lot, but much of that builds on a legacy of important investments in research and development by the U.S. government through its various agencies. And we've seen those investments in better drugs, diagnostics, vaccines, et cetera, pay off in the last 15 years, and particularly in the last 5 years, in terms of the decline in child mortality. If you look at disease elimination, polio, Jimmy mentioned polio. We've only had 34 cases of polio in the world this year. That's the lowest ever. It's about half of last year. And I think we're poised with very strong programs and increasing accessibility, even in conflict-prone and plague states like Afghanistan, as we reviewed today with the WHO office here, improving access, improving quality of campaigns, improved use of data to drive the performance of programs has brought us really to the brink of polio eradication. And again, the leadership of the U.S. government, both in terms of its technical secundees to the Global Polio Eradication Initiative, largely from CDC, but from many others, has been critical to that success, as well as obviously the U.S. government's participation, along with many others, in funding the Global Polio Eradication Initiative. Malaria, between 2000 and 2015, global malaria mortality rates decreased by 60%, and the incidence rates declined by 40%, placing malaria eradication technically within reach of a lifetime. But I think there we're going to have to see a balance of, we've seen progress. Sri Lanka recently was declared malaria-free, and another dozen countries have now gone more than a year without a case of malaria. Investments over the past 15 years have spurred the development of new tools, substantially increased the access to life-saving drugs, diagnostic bed nets, and saved more than 3.3 million lives. But to eradicate malaria globally, we're going to have to continue to invest in research and development. We probably can't get there, particularly in the endemic heartland, without new tools for treatment and new technologies for prevention. At the same time, if you look at the pipeline of innovation, I know you've got a session on innovation later today, it's really one of the most promising pipelines of new innovation that we've seen across vector control, vaccine, drug development. If we take the area of neglected diseases, tropical diseases that Jimmy also mentioned, since the London Declaration on NTDs in 2012, pharmaceutical companies have donated $17 billion worth of treatments to stop neglected diseases from ravishing the poorest and often most marginalized communities. Nearly 1 billion people receive treatments for NTDs, largely based on donated medicine in 2015 alone. That's 200 million more than just 2 years ago. So we're seeing a very important public-private partnership really in a sustainable way to bring life-saving medicines, often at very large scale through mass drug administration programs, into some of the poorest countries in the world. In women's health, we've now seen, since the London Summit on Family Planning back in 2012, the world has collectively helped to support expanded access, and 30 million additional women and girls are now enjoying access to voluntary contraceptive services this year compared to back just 4 years ago in 2012. So there's a tremendous amount of improvement and progress and momentum. And so I think it's particularly important for the committee to reflect on how to sustain and, if possible, actually accelerate some of that momentum. Because there's lots of challenges left. While we've made lots of progress, we've still got lots of areas where we're not reaching everybody with the tools we have today, let alone investing adequately in the tools that we need for tomorrow. If you take HIV, I'm sure Mark will talk more about this. We've seen huge successes in the fight against HIV, notably in expanded treatment access, but it still remains a very deadly epidemic with a million people a year being killed by HIV. So we need to continue to invest in expanding access further, reaching more marginalized populations, and in particular, pay attention to where the data points us. Adolescent girls and young women in sub-Saharan Africa are now at disproportionate risk, accounting for maybe 25% of new HIV infections. And so we have to, as we've learned in the final stages of polio eradication and many other programs, we have to have the data drive us to our future steps and focused action, especially if resources are going to be constrained. We also have to pay attention to the lessons that we've learned, very hard lessons that we've learned from the recent epidemics of Ebola and Zika, which have exposed serious gaps in the world's ability to quickly develop and deploy new tools to prevent, detect, and respond to outbreaks, and have threatened really the global agreements that were reached about health security and about the ability of nations to rapidly respond, report, and recruit the appropriate technical assistance needed and resources needed to stop outbreaks before they become serious and large-scale population events. In that event, we need to both improve the work that the U.S. government is supporting through the Global Health Security Agenda for better preparedness and response, strengthening outbreak alert and response workforce. The IOM and a variety of other bodies have opined on lessons learned from the Ebola outbreak. And in those reports has been an important emphasis on continuing to invest in research and development related to epidemic preparedness. The Gates Foundation, together with a broad set of other public and private sector partners, has been participating in the development of the Coalition for Epidemic Preparedness Innovation, CEPI, which is really a breakthrough approach to try to accelerate research and development for new vaccines and potentially ultimately other important tools to address both known threats as well as developing platforms that could be adapted rapidly for emergent or unknown threats. And that coalition will be launched in January. I think another important thing that we have to pay attention to, as I mentioned in some of my original comments, is the growing health inequity. And how do we think about the opportunity to really achieve what has been referred to as a grand convergence, or to eliminate the tremendous inequity over the next decade or next generation. But that's going to require persistence. It's going to require predictable streams of funding, and it's going to require innovative partnerships that include both multilateral organizations, philanthropic organizations, civil society, and government. I think in particular, maybe if I can just respond to one thing Jimmy said, I think we can't be pessimistic about the sometimes frustrating efforts we've seen in health system strengthening, particularly as we recognize an emergent, what some have called the dual burden of diseases, as where we have 4 countries that haven't finished the job of reducing mortality from infectious disease, reproductive maternal health causes, and yet are beginning to experience a second wave of disease burden from chronic diseases, non-communicable diseases related to diet, environment, etc. We can't afford to have a large number of additional bespoke programs for diabetes, hypertension, etc. We're going to have to learn about how to integrate these. And I think, what underlies the appropriate response to many of those diseases, as well as the ones that we've traditionally worked on, is a strong primary health care system. And I think in that regard, there are some innovative experiences in trying to work particularly at country-led efforts, and Mark will talk about this, I'm sure, from the Global Fund's experience. It's also Bengavi's experience, to how to support countries to develop their systems, to not just have an unaccountable investment in a vague notion of health systems, but to actually measure the performance of health systems and to invest against that performance, because ultimately we need a functional primary health care system if we're going to be able to address many of the remaining causes of maternal newborn child health, morbidity and mortality, but also a growing burden of non-communicable diseases. So I think I'm going to stop there, and I'm happy to respond to questions or specific inquiries about what the Gates Foundation is doing in these various areas I touched on. Thank you.
Thank you very much. We will now turn to Dr. Mark Dybel, who's the Executive Director of the Global Fund. Welcome, Mark.